Hello everyone, I'm Dr. Sneh Verma from the School of Dental Sciences, BBD University. In today's lecture, we are going to discuss about the history and basic principles of orthodontics. What is orthodontics? So, as we know, orthodontics is a branch of dentistry that deals with the correction of teeth, correction of malaligned teeth. So, it is a Greek word that means when we describe it, orthos means to correct straight or righten up the teeth, that is odontos. So it is a science that deals with the correction of teeth. This definition of orthodontics was given by British Society in 1922, which claims it's a big definition which can be divided in 3-4 parts. One, that it includes study of growth and development of jaws and the face particularly, and body generally as influencing position of the teeth. It also deals with the study of action and reaction of internal and external influences on the development, prevention and correction of arrested and perverted development. So it is definitely a long definition to remember. So we can break up into these 3 lines so that we can easily remember the definition. What are the orthodontics treatment? Aims of the orthodontic treatment. So the treatment provided should not only satisfy the patient's aesthetic desires but also satisfy certain functional and physiologic requirements. It was the Jackson who summarized the aims and objectives of orthodontic treatment, which is known as Jackson's triad. In this triad, the units involved are functional efficiency, structural balance, and the aesthetic harmony. Functional balance, efficiency, the form and function are interrelated. Any deviation from the normal occlusion may adversely affect the normal functions carried out by the oral cavity. So, one of the main aim of orthodontists is to improve the functional efficiency of the stomatognathing system along with the improving the aesthetics. Coming to the structural balance, orthodontic treatment affects as an entire stomatognathing system, which includes not only the teeth, but it also involves the skeletal tissues, soft tissues, and which include the musculature. So, the treatment should maintain a balance between these structures, and the correction of one should not be detrimental to the health of the other. Why the aesthetic harmony in this triad? Because most of the individuals seek orthodontic treatment to improve the appearance of the smile and the face. The orthodontic treatment should increase the overall aesthetic appeal of the individual. Thus, the orthodontic treatment aims at improving the aesthetics of the individual as a whole. This orthodontic term was first used by the Frenchman Lee Fellon in 1839. Next, in this video, we are going to discuss about the history of the orthodontic, overall orthodontics, from where it began and till date where we are. So the earliest description of irregularities of teeth was given about 400 BC by the Hippocrates. In 384 to 322 BC, it was a Greek philosopher, Aristotle, who studied the tooth in a broad manner, and he stated that there is a marked difference between human teeth and those of animals. And he also stated that there is a difference between the teeth in the different species of animals also. Then again, the Paul of Angina stated that when supernumerary teeth causes an irregularity of the dental arches, they may be corrected by resection of such teeth or by extraction. He stated that irregular teeth were displeasing in women. Coming to somewhat closer, from 14th to 16th century, it was the person Leonardo da Vinci who first recognizes the tooth form and realized that each tooth was related to another teeth and the opposing jaws as well. Then in the next century, 16th to 17th century, it was the periodontist who has called the dentist as the operator for the teeth, and he stated that these dentists can open or widen the teeth when they are set too close together. Then again, in the 18th century, we are coming more closer. So in the history, it was the Pere Fouchard, which has been known as the father of orthodontia, and also he is referred as a founder of modern dentistry. Etienne Baudet was the person who first recommended serial extraction and extracting the premolars to relieve crowding. And he was the person who first practiced the lingual orthodontics, that he tried to expand the arches from the lingual side. Then coming to the contribution of John Hunter, although he was not a dentist, he was an English anatomist and surgeon, but he had keen interest in anatomy of teeth and jaws. His text, The Natural History of Human Teeth, which was published in 1771, that was the book that presented the first clear statement of orthopedic principles. He was the person who described the normal occlusion to attempt to classify the teeth. He was the person who described the growth of the jaws. And in 19th century again, the person Joseph Fox, who was an influential student of Hunter, devoted 4 chapters to the book The Natural History and Disease of Human Teeth, to the budding science of orthodontics. He was the first person to classify the malocclusion in 1803. He was the first to observe that mandible grows mainly by distal extension beyond the molars, with little or no increase in the anterior region. According to Weinberger, Joseph Fox was the first to give explicit directions for correcting the irregularities of teeth. He was interested in the judicial removal of deciduous teeth, treatment timing, and use of bite blocks to open the bite. And he also included the expansion arch and the chin cup to the orthodontia. Joachim Lee Fillon gave the science name orthodontoids. He was the first person who combined the labial arch with the lingual arch. Sneh was the person remembered to introduce the modification of screws and the clamp bands. And the most important idea is his demand that pulling arrangement can be anchored principally on several molars, which are generally bound together with a gold clamp, and that mechanical immobilization of what have been achieved so far be carried out for a long time. And he was the person who coined the term anchorage, and today we know what are the importance of anchorage in orthodontia. And he was also the first person to use the rubber bands in the orthodontia. Again, in 18th through 19th century, it was Kenesaw who was first to use the removable appliances when he fitted his prognathic patients with a chin cap. And he used the gold springs as an inclined plane. This modification of inclined plane marks the limit of his orthodontic therapy. Toms was the first to demonstrate bone resorption and apposition, and that was a great contribution to the orthodontics. He and Nischal worked together and used various removable appliances to correct the malocclusion. Then some few more contributions by the Kocher. He offered to supply ligatures to teeth of an irregular position, and he was an advocate of early treatment. Harris used the gold caps on molars to open the bite and knobs shoulder to a band for tooth rotation. In 1941, it was Lintott who introduced the use of screws. M.A. Strange introduced the use of cribs, which was a modification of screw. Gunnell invented the occipital anchorage. Solomon Brown, the efforts of Solomon Brown in 1839, the first dental journal, the American Journal of Dental Sciences, was established by him. Coming to the history of orthodontics from the late 19th century, the pioneer was the Norman Kingsley, whom Dr. Edward H. Engel referred as orthodontia's greatest genius. And from the early 1900s, as there was a groundbreaking scientist, built the orthodontics edifice brick by brick as we see is at today. After the 1850, the most notable was Kingsley's book, A Treatise on Oral Deformities. In that book, he mentioned about the cleft palate prosthesis, and more than 100 articles he has written about the cleft palate rehabilitation, inadequacies of cleft palate surgery, obturators, orthodontic diagnosis, orthodontic appliances, and he also introduced the occipital anchorage in orthodontics. That figure shows the occipital anchorage taken by him. He described the term jumping the bite, and his main objective was not to protrude the lower teeth, but to change or jump the bite in cases of excessively retreating lower jaw, which we see today as a foundation for our selection of myofunctional appliances for jumping the bite to correct the class 2 malocclusion. Westcott first used telescopic bar in maxilla to correct the crossbite. He placed chin cups in class 3 patients. Emerson C. Engel was the first to open the mid-palatal suture in the 1860 itself. McGill was first to use the platinum bands in 1871. Often, as we know, the spring for a slow maxillary expansion, and he was the student of Kingsley. He tried to expand the arches, and this coffin spring bears his name as a CR coffin. From that, we know the coffin spring. Then there was a John Nutting Farrar, who began the era of biological tooth movement. Whatever we know, we read in the biology of tooth movement, how the tooth moves within the bone from one place to another. What are the biologic cascade or reactions in the structure itself? It was initially begun by the Farrar. So he was first to use the occipital anchorage to retract the anterior teeth. He recommended bodily movement of teeth and also given the theory of intermittent forces and developed a screw to deliver this force in controlled increments. So these are the appliances which he has used. And again, his treatise on irregularities of teeth and their correction is considered a great work devoted exclusively to the orthodontics. And he is mentioned as a father of American orthodontics. Was the first to suggest a possible cause of deformities and proposed that all malocclusions patients are either neurotoxics, idiots, generators, or lunatics. He was the first dentist to specialize in both orthodontics and periodontics. Coming to the contribution of Baker, he introduced intermaxillary rubber bands to correct the protrusion, and now we are well familiar with the term Baker's anchorage. That is intermaxillary anchorage. Coming to the contributions given by the Edward Hartley Engel, which we know as the father of orthodontics. He was born in a farm in Pennsylvania in 1855. He marked the ability to improve and create mechanical equipment on the farm and developed a passion for simplicity in the design. Then in 1900, he founded the first postgraduate school of orthodontics as Engel School of Orthodontia. In 1907, he founded the first orthodontic journal, the American Orthodontist, which is a pioneer journal in the field of orthodontics. He stated the best balance, the best harmony, the best proportions of the mouth in its relation to the other features require that there shall be a full complement of teeth and that each tooth shall be made to occupy its normal position, that is normal occlusion. So the main thing, he was the advocate that all 32 teeth should be well maintained in the dental arches and no extraction should be done to get a proper normal occlusion. Engel develops classification of malocclusion, and that was published initially in the Dental Cosmos in 1899. In his classification, he has taken the maxillary first permanent molar as a stable landmark in a craniofacial anatomy, and based on that, he has classified the malocclusion into 3 classes. We are well aware about that, the class 1, class 2 and class 3 malocclusion. So, he consulted the famous artist of the day, Professor Werpel, for the ideal facial form. The facial forms in the orthodontics was also described by the Engel. Engel showed the straight profile Apollo Belvedere as his ideal face, having a straight profile. Coming to the contribution of German physiologist Julius Wolff, who stated that that we know it as a law of transformation of bone. Wolff's law stated that bone in a healthy person or animal will adapt to the loads under which it is placed. Mother Engel later became secretary of American Society of Orthodontics, and she was a wife of Hartley Engel, and she was a founding co-editor of the Engel Orthodontist, an honorary chair of the Engel Society Executive Committee. Later, he became Anna Hopkins Engel, or named as a Mother Engel. Cecil Steiner stated that she was a suitable counterfoil for Edward H. Engel, and also she was the power behind the throne. Then later on, in 1900, Engel has given the E-arch appliance, different appliances, among which E-arch is the one. The heavy arch wire was supplied in 4 designs depending on the treatment plan. One is the basic E-arch used in mandible with the Baker anchorage. Then second one is the ribbed E-arch that was used for expansion. This appliance was simple but providing the heavy interrupted forces, and it was able to tip the tooth to the new position. But with this appliance, it was not possible to precisely position any individual tooth. Then E-arch with hooks. With this appliance, he moved the maxillary dentition distally and the mandibular dentition mesially through intermaxillary elastics. E-arch without threads, threaded ends attached ball in incisal area for hypal headgears. These are the various variations which Engel modified his appliances one by one to finally come to the latest plans. So after E-arch, he has given the pin and tube appliance in 1910. This appliance has incredible degree of craftsmanship, but it was impractical in clinical use because of poor spring qualities. So this is the pin and tube appliance, the complicated appliance, which was not very practical to use. Then again, after that, in 1916, the Engel described about the ribbon arch appliance, and the first bracket was introduced by Engel in 1916 for use with this ribbon arch mechanism. Here, we can see the vertically positioned rectangular slots here with ribbon arch of 10 into 20 gold wire. And this appliance has a gold spring quality, so it allows the versatile movements of the teeth, which was not present in the earlier E-arch or pin and tube appliance. Later in the 1925, he converted his ribbon arch from the vertical slot to the horizontal slot and given it as name as an edgewise appliance, which we are very much familiar to us, and we are using this because it has a three-dimensional control over the tooth movement. It is the most accepted appliance, and he was the person who gave the philosophy of edgewise bracket. And with this bracket, later on, Tweed gave the edgewise appliance. So all said and done, Engel possessed extraordinary technical skills, a very inventive mind, and an unbending, uncompromising nature, which truly makes him a mechanical, technical, and clinical genius, the repercussions of whose inventions and contributions are strongly felt even today. So very aptly and deservingly, he is called the father of modern orthodontics. Later on, Kelvin Case, he was the graduated from the Ohio College of Dental Surgery, who wrote a practical treatise on techniques and principles of dental orthopedia and wrote 123 articles about this. He was forced to use with Henry Baker's class 2 elastics and was the first to attempt the bodily movement. He was forced to use light wires, and against the Engel's philosophy, he advocated the extraction to correct the facial deformities. He used the headgears for cleft patients and others, and his greatest contribution to the prosthetic correction of cleft palate. So because Engel was an advocate of the non-extraction philosophy, and later on Tweed has described about the extraction treatment mandatory for the correction of malaligned teeth. So there was a great extraction controversy in 1911. So later on, few other researchers have described the orthodontics treatment in their own way, as Fauchard and Celsus recommended extraction. Hunter opposed it on the ground that it inhibits the growth. Delabere warned against undesirable sequelae of extractions. Then Kingsley, after initially extraction of premolars, later gave it up and stick with the non-extraction philosophy. Davenport lectured in New York about this, but Kelvin Case reintroduced the extraction to the orthodontics. Martin Dewey, he took the gauntlet for non-extraction and challenged the case. Ortho thought, including early regulation, heredity, bone growing, and evolution, was his contribution. But Engel's follower won the day, and for the next 30 years, extraction was disappeared from the orthodontics. Everyone was doing the non-extraction treatment. Orthodontists such as John Merson, Joseph Johnson, George Crozet, whose appliances relied on non-extraction philosophy, helped to perpetuate this philosophy. But by 1930s, dentists were beginning to notice a relapse in the cases which was done by non-extraction. So, in Martin Dewey, who was born in 1881, in 1902, attended one of the first class of Engel School of Orthodontics. He, in 1914, he has written The Practical Orthodontics, Orthodontic Philosophy and Mechanical Procedures. In 1915, with C.V. Mosby, Dewey founded and became editor of the International Journal of Orthodontia. During the extraction debate of 1911, he was the chief spokesman on the side of non-extraction. Then Hugo Jackson, he was the pioneer of removable appliances in the US, whose spring we know as the Jackson spring. And in 1904, he written the Orthodontia and Orthopedia of the Face. Hawley's retainer, we are well known to this. This was given by Charles A. Hawley in the 1908. Leisure, given the classification of malocclusion, he coined the term mesoocclusion, testoocclusion, and neutro-occlusion, and he stressed the relationship between muscles malformation and malocclusion. Milo-Hellman gave the attention in the science of anthropology and its relation to the growth and development of human dentofacial complex. He introduced craniometric measurement, challenged Engels' notion of the maxillary first molar as the key to the occlusion. He was the person who gave attention to the periods of acceleration and retardation in the facial growth that we know as a growth spurt. George Crozet in 1921 originally called invisible braces, which later became as a Crozet appliance. Then in 1940s and 50s, it was the person Charles S. Tweed who introduced edgewise appliance based on basal bone concept. Oppenheim in 1942, he gives the tissue changes incident to the tooth movement. Kessling used a rubber tooth positioning device in which teeth were moved into a more ideal cuspal relationship after major correction has been accomplished. Salzman classification of malocclusion for handicapping problems. In later on 1960s and 70s, the Raymond Beck, who was born on October 13th, 1898 in Western Australia, he joined the Engel School of Orthodontia. Graeber, born in St. Louis, he was graduated from the Washington University, St. Louis, and given the recognizable contribution in the orthodontics. Ricketts developed his orthodontic therapy as a bioprogressive therapy, which forms a background of edgewise and Beck technique. He introduced a versatile utility arch for the intrusion of the maxillary and mandibular anterior teeth. And he was the person to use the preformed bands on the teeth. And Ricketts had given the quad helix appliance with the O40 blue alloy wire. Contribution of the Charles Burstone. He was a notable authority on biomechanics. He introduced TMA, Chinese nitai wire, fiber reinforced composites, and he also introduced the use of holography and occlusograms in the orthodontics. And the major contribution was the segmented arch technique given by him for the correction of malocclusion. Then Lawrence F. Andrews, he was known as the father of pre-adjustment bracket system, because before that, in the edgewise appliance, the persons have to do a massive wire bending to correct the teeth in all three planes of space. But Andrews introduced the pre-adjusted bracket system, that all the things were included in the bracket itself, and no wire bending or minimal wire bending was required during the arch wire insertion, during the correction of malocclusion. So he is known as the father of pre-adjusted bracket system. So he uh, has given the 6 keys of occlusion in 1972 by observing the 120 non-orthodontic normal cases which have never gone orthodontic treatment. Based on the observation on those models, he has given 6 keys which are the foundation for us thing to what to see in the final outcome, what should be there in the well-balanced occlusion. So these keys was given by Andrews. He also has given the straight wire appliance, that is pre-adjusted appliance. Then in the field of removable appliances in the 1977, Clark's has given the twin block appliance as a myofunctional appliance for the rapid functional correction of malocclusion. It is the most accepted appliance after the activator bionator, because it's a two-piece appliance which gives more freedom to the patient to speak and eat and everything, which is not possible in the monoblock appliance as Anderson's activator or Walter's bionator, because they are the one-piece appliance. So the major contribution of Clark's is a introduction of twin block in the orthodontics, which is a basic appliance nowadays for correction of class 2 and class 3 malocclusions. So principles of orthodontic treatment after this history part, there are various disciplines of orthodontic treatment which we known as the can describe as a preventive orthodontics, interceptive orthodontics, corrective orthodontics, or surgical. For all these things, the timing of the treatment, appliance selection, post control, timing of wearing the appliance, and retention, all these are the factors which will govern by the appliance. So preventive orthodontics, as the name implies, is the action taken to preserve the integrity of what appears to be normal occlusion as a specific time. It includes the procedures undertaken prior to the onset of the malocclusion in anticipation of a developing malocclusion. So it is also known as a primary prevention or a preventive orthodontics. In the interceptive orthodontics, it includes it's a phase of science and art of orthodontics employed to recognize and eliminate potential irregularities and malpositions in the developing dentofacial complex. Why? Interceptive orthodontics includes procedures that are undertaken at early stage of a malocclusion to eliminate or reduce the severity of the same. As I have talked about the preventive, there was no malocclusion is still there. That are preventive measures said no malocclusion should be there. But in interceptive, the malocclusion has already been started, and we have to intercept by our interceptive measures. This stage differs from the preventive orthodontics in that here already malocclusion sets in. By undertaking appropriate interceptive procedures, it is possible to prevent establishment of a full-fledged malocclusion that may require long-term orthodontic treatment at a later stage. So certain procedures under the preventive and interceptive orthodontic may overlap, but they are different to each other. What comes under corrective orthodontics? These are the orthodontic procedures undertaken to correct a fully established malocclusion. So up to this stage, malocclusion has already been settled out, and this phase involves the uh, recognition, it recognizes the existence of a malocclusion and the need for employing certain technical procedures to reduce or eliminate the problem and the further sequelae. The procedure employed in the correction, that may be mechanical, functional, surgical, that is fixed, that may be removable orthodontics, fixed orthodontics, etc. In the surgical orthodontics, we undertake the procedures in conjunction with or as an adjunct to the orthodontic treatment when all the time has gone for the preventive, interceptive, and corrective orthodontics, then or the problem is so severe that cannot be corrected with the corrective orthodontics alone, we has to move to our planning toward the surgical orthodontics depending on the severity of malocclusion. So these timing of the treatment, appliance selection, post control, timing of wearing the appliance retention, these are the things we should consider when we deal with the treatment planning of our patient. So something about the Indian orthodontic history. So there is our oldest orthodontic department was established in Naya Dental College, Bombay. MDS in orthodontics was started in Naya Dental College itself in 1959, and the first study group was established in 1963 as the orthodontic study group in Naya Dental College, Bombay itself. So Indian Orthodontics Society was invented in 1965, and the first annual conference was there in the 1967 in New Delhi. First PZ convention is uh, in progress from the 1996 till now, and Journal of Indian Orthodontic Society was established in the 1965, which publishes the various scientific articles from our different authors. So thank you. I hope you are now aware of the history and the things which our great scientist has given to us in the field of orthodontics. Thank you.